Omega-3 fatty acids are incredibly important. They have many powerful health benefits for your body and your brain. In fact, few nutrients have been studied as thoroughly as omega-3 fatty acids. Depression is one of the most common mental disorders in the world. Symptoms include sadness, lethargy, and a general loss of interest in life. Anxiety, also a common disorder, is characterized by constant worry and nervousness. Interestingly, studies indicate that people who consume omega-3s regularly are less likely to be depressed. What's more, when people with depression or anxiety start taking omega-3 supplements, their symptoms improve. There's 3 types of omega-3 fatty acids: ALA, EPA, and DHA. Of the 3, EPA appears to be the best at fighting depression. One study even found that EPA was as effective against depression as common antidepressant drugs. DHA, another type of omega-3, is a major structural component of the retina of your eye. When you don't get enough DHA, vision problems may arise. Interestingly, getting enough omega-3 is linked to a reduced risk of macular degeneration, one of the world's leading causes of permanent eye damage and blindness. Omega-3s are crucial for brain growth and the development in infants. DHA accounts for 40% of the polyunsaturated fatty acids in your brain and 60% in the retina of your eye. Therefore, it's no surprise that infants fed a DHA fortified formula have better eyesight than infants fed a formula without it. Getting enough omega-3 during pregnancy is associated with numerous benefits for your child, including higher intelligence, better communication and social skills, fewer behavioral problems, decreased risk of developmental delay, and decreased risk of ADHD, autism, and cerebral palsy. Heart attacks and stroke are the world's leading cause of death. Decades ago, researchers observed that fish-eating communities had very low rates of these diseases. This was later linked to omega-3 consumption. Since then, omega-3 fatty acids have been tied to numerous benefits for heart health. These benefits address triglycerides. The omega-3s can cause a major reduction in triglycerides, usually in the range of 15 to 30%. And blood pressure. Omega-3s can reduce blood pressure levels in people with high blood pressure. Omega-3s can raise good HDL cholesterol. Omega-3s can keep blood platelets from clumping together. This prevents the formation of harmful blood clots. By keeping your arteries smooth and free from damage, omega-3s help to prevent the plaque that can restrict and harden your arteries. Omega-3 reduces the production of some substances released during your body's inflammatory response. For some people, omega-3s can lower bad LDL cholesterol. However, evidence is mixed. Some studies find increased LDL cholesterol. Attention deficit hyperactivity disorder, or ADHD, is a behavioral disorder characterized by inattention, hyperactivity, and impulsivity. Several studies note that children with ADHD have lower blood levels of omega-3 fatty acids than their healthy peers. What's more, numerous studies observe that omega-3 supplements can reduce the symptoms of ADHD. Omega-3s help to improve inattention and task completion. They also decrease hyperactivity, impulsiveness, restlessness, and aggression. Recently, researchers observed that fish oil supplements were one of the most promising treatments for ADHD. Metabolic syndrome is a collection of conditions. It includes central obesity, also known as belly fat, as well as high blood pressure, insulin resistance, high triglycerides, and low, good HDL cholesterol levels. It's a major public health concern because it increases your risk of many other illnesses, including heart disease and diabetes. Omega-3 fatty acids can improve insulin resistance, inflammation, and heart disease risk factors in people with metabolic syndrome. Inflammation is a natural response to infections and damage in your body. Therefore, it's vital for your health. However, inflammation sometimes persists for a long time, even without an infection or an injury. This is called chronic or long-term inflammation. Long-term inflammation can contribute to almost every chronic Western illness, including heart disease and cancer. Notably, omega-3 fatty acids can reduce the production of molecules and substances that are linked to inflammation, such as inflammatory eicosanoids and cytokines. Studies have consistently observed a connection between higher omega-3 intake and reduced inflammation. In autoimmune diseases, your immune system mistakes healthy cells for foreign cells and starts attacking them. Type 1 diabetes is one prime example in which your immune system attacks the insulin-producing cells in your pancreas. Omega-3s can combat some of these diseases and may be especially important during early life. Studies show that getting enough omega-3s during your first years of life is linked to a reduced risk of many autoimmune diseases, including type 1 diabetes, autoimmune diabetes, and multiple sclerosis. Omega-3s also help to treat lupus, rheumatoid arthritis, ulcerative colitis, Crohn's disease, and psoriasis. Low omega-3 levels have been reported in people with psychiatric disorders. Studies suggest that omega-3 supplements can reduce the frequency of mood swings and relapses in people with both schizophrenia and bipolar disorder. Supplementing with omega-3 fatty acids may also decrease violent behavior. A decline in brain function is one of the unavoidable consequences of aging. Several studies link higher omega-3 intake to decreased age-related mental decline and a reduced risk of Alzheimer's disease. One review of controlled studies suggests that omega-3 supplements may be beneficial at disease onset when the symptoms of Alzheimer's disease are very mild. Cancer is one of the leading causes of death in the Western world, and omega-3 fatty acids have long been claimed to reduce the risk of certain cancers. Interestingly, studies show that people who consume the most omega-3s have up to a 55% lower risk of colon cancer. Additionally, omega-3 consumption is linked to a reduced risk of prostate cancer in men and breast cancer in women. Asthma is a chronic lung disease with symptoms like coughing, shortness of breath, and wheezing. Severe asthma attacks can be very dangerous. They're caused by inflammation and swelling in the airways of your lungs. What's more, asthma rates in the United States have been rising over the past few decades. Several studies associate omega-3 consumption with a lower risk of asthma in children and young adults. Non-alcoholic fatty liver disease is more common than you think. It's increased with the obesity epidemic to become the most common cause of chronic liver disease in the Western world. However, supplementing with omega-3 fatty acids effectively reduced liver fat and inflammation in people with non-alcoholic fatty liver disease. Osteoporosis and arthritis are two common disorders that affect your skeletal system. Studies indicate that omega-3s can improve bone strength by boosting the amount of calcium in your bones, which should lead to a reduced risk of osteoporosis. Omega-3s may also treat arthritis. Patients taking more omega-3 supplements have reported reduced joint pain and increased grip strength. Menstrual pain occurs in your lower abdomen and pelvis and often radiates to your lower back and thighs. It can significantly affect your quality of life. However, studies repeatedly prove that women who consume the most omega-3s have milder menstrual pain. One study even determined that an omega-3 supplement was more effective than ibuprofen in treating severe pain during menstruation. Good sleep is one of the foundations of optimal health. Studies tie sleep deprivation to many diseases, including obesity, diabetes, and depression. Low levels of omega-3 fatty acids are associated with sleep problems in children and obstructive sleep apnea in adults. Low levels of DHA are also linked to lower levels of the hormone melatonin, which helps you fall asleep. Studies in both children and adults reveal that supplementing with omega-3 increases the length and the quality of sleep. DHA is a structural component of your skin. It's responsible for the health of cell membranes, which make up a large part of your skin. A healthy cell membrane results in soft, moist, supple, and wrinkle-free skin. EPA also benefits your skin in several ways, including managing oil production and hydration of your skin, preventing hyperkeratization of hair follicles, which appears as little red bumps, often seen on the upper arms, reducing premature aging of your skin, reducing the risk of acne. Omega-3s can also protect your skin from sun damage. EPA helps to block the release of substances that eat away at collagen in your skin after sun exposure. Typical doses of omega-3s can be 3 to 9 grams per day of an EPA, DHA, molecularly distilled omega-3 fish oil.